welcome to our channel. I'm Dr. John Lucio, and I practice integrative medicine and pain management in Jefferson City, Missouri. Welcome to J&J House Call. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology, sexual health for both men and women, and integrative medicine. Welcome back to our channel. Today's going to be a great topic. Dr. Lucy and I have a passion for hormone balance in both men and women. So stay tuned, and if you haven't subscribed, please go ahead and do so, and always hit that notification bell so you know when we've uploaded our next video. And give this video a thumbs up. We appreciate it.
In the next few weeks, we're actually going to be going into greater detail into men's health and talking about testosterone, which is really not the only hormone we should be worrying about, and your doctor should be measuring it as well.
The symptoms of low testosterone are pretty non-specific. They probably sound a lot like hypothyroidism, anemia, depression, normal aging.
The symptoms of low testosterone, they're all over the TV and everything. It usually has to do with sexual health, low libido, and erections and so forth. But actually there are a lot of other symptoms that men can experience that might indicate to you that you have low testosterone. In addition to having poor morning erections, low libido, erectile dysfunction, you can also have a depressed mood, and people may start feeling kind of grumpy and anxious and have insomnia. That may also be an indication of low testosterone. But it was also interesting, you also have to look at things like fatigue that's increased over the recent period. Decreased vitality, in other words, you just don't have the same energy level that you had before. Low mental energy, like you just don't want to concentrate on things like you did before. Insulin resistance, which is actually very serious. In other words, can lead to diabetes and increasing abdominal obesity. Isn't this starting to sound like what people say you're just getting older? Well, there's a reason you feel this way, is because it can be your low testosterone. Some of the other things too, you start noticing your blood pressure starting to rise, decreased muscle mass. You're not good as, not performing in sports like you used to in the past. You start developing osteoporosis and brittle bones, and you start having problems with your cholesterol and triglycerides. So the testosterone hormone in our body is kind of like a master hormone, especially for men. It's like the builder hormone. And so when it starts to lower, it affects almost every part of our system. It affects even our skin, hair loss, those kind of things are all affected by testosterone level. It can also give you a clue on whether you are starting to have low testosterone. So it's not just the sexual part of it. One of the common questionnaires that are used by physicians is something called the ADAM questionnaire. And what this does, it looks at questions about libido, your energy, your strength, whether you lost height, do you have decreased enjoyment of life, you start feeling grumpy all the time, your erections are not as strong as they used to. And there's a series of questions, and if you start answering the affirmative in these questions, then it may indicate that you have low testosterone and may need further testing.
If you're clicking into this video, you probably are wondering if you're at risk for having low testosterone. You may feel pretty good, and you just kind of want to know if you're at risk for having low testosterone. So we listed a couple of medical conditions, and it's a huge entire list. So if you have any of the following, you could be at risk for low testosterone. Ready? It's non-insulin dependent diabetes mellitus, which means it's adult onset diabetes, obesity, metabolic syndrome, taking steroids, taking opioids, alcoholism. Spironolactone is a medication that can be related to low testosterone. Taking a 5-alpha reductase inhibitor medication can cause low testosterone. HIV-associated weight loss, end-stage renal disease, and being on dialysis for your kidneys. Moderate and severe COPD, which is chronic obstructive pulmonary disease. Infertility, osteoporosis, or having a fracture with not much trauma. So it's called a low trauma fracture, especially if you're a young gentleman. And having a sellar mass or receiving radiation to the sellar area. Those all put you at risk for having low testosterone.
Yep.
So we hope this is helpful. We appreciate you guys, and we appreciate your wanting to be healthy.
That's it for today. So long, everybody.